here with our Office of Healthcare Equity and our community conversations. We have a really great topic to discuss today. We're going to be talking about equitable access to breast cancer screening. This session will be recorded and it will go up on our community conversations webpage. So I will put that link in the chat. So you can feel free to send this to whomever. Please feel free to use the Q&A if you'd like to submit questions. Thank you. I'm going to hand this to Anita.
Thank you so much, Priscilla. And hello, everyone. Welcome to this edition of Community Conversations. Honoring Breast Cancer Awareness Month this October, we bring to you this town hall on the importance of breast cancer screening and equitable access around it. And I'm so honored to have our amazing panelists here today. We have Paula Houston, who is Chief Equity Officer, Office of Healthcare Equity, UW Medicine, Associate Vice President for Medical Affairs, University of Washington, and Affiliate Professor, Department of Family Medicine. We have Nikem Akinsoto. Nikem is Assistant Director, Population Health. Dr. Vicky Fang, who is Medical Director, Primary Care and Population Health, UW Medicine. And I'm also honored to have with us Bridget Hampstead, founder of Sierra Sisters, which is a breast cancer survivor and support program. I'm so delighted to have you. And I have Priscilla Estrada, who is a communication specialist from the Office of Healthcare Equity. Thank you very much. Welcome. Thank you for joining us. And I'll start off with Vicky. Vicky, why are mammograms so important? Who are eligible to get mammograms?
Thanks, Anita, and thanks for inviting me to this webinar. Mammograms are important because they save lives. It's important to know how common breast cancer is. For people assigned female gender at birth, the leading cause of death between ages 45 and 84 is cancer. Breast cancer is the most common cancer for that group. In a lifetime, a woman, people assigned female gender at birth have about a 1 in 8 risk of getting breast cancer. So it's hugely important and common. One of the things that helps us decide whether or not to screen for a cancer, as a primary care doctor, I often get asked, well, why don't you screen me for brain cancer? Why don't you screen me for this other cancer? Well, what we screen for cancers when they are common enough that we are going to be able to find people. We screen for them when we can actually do something to help them when we get that information. And we screen when we actually have a screening test that will work to do those things. And breast cancer is one of the huge success stories in modern medicine around screening. We know that once screening with mammography was introduced on a more wholesale basis in the 1980s, that the risk of dying from breast cancer dropped not the risk of getting breast cancer, but the risk of dying from breast cancer dropped. And the reason for that is that early detection is the most important tool, one of the most important tools we have for curing cancer. If we catch something early, if you catch something early, we're going to be able to take care of it. If we don't catch it together until it's late, even with all the advances in medicine, we may not be able to cure. So that's why it is so important. It's really the cornerstone of improving longevity for women from cancer. Who is eligible? If you are between the ages of 40 and 75 and of average risk, Those are the people that we are looking for breast cancer screening. Some people need to start earlier than age 40, and that is because they are at higher risk. And some of the risks that are out there include genetic risks. So family history is very important, but also lifestyle issues, diet. It turns out that the same things that have driven increase in body size have also increased cancer risk. So our highly processed foods, higher fatty food diets are all risk factors. Certain types of work habits even. There are some data that shows that women who work night shifts are at slightly higher risk for breast cancer. So knowing what your risk factors are and getting educated about those may help determine whether or not you would start earlier than age 40. But all people who are assigned female gender at birth are eligible to get breast cancer screening with mammography.
Thank you so much. This is so very important. And Vicky talked about early detection, which can save lives. And breast cancer is a type of cancer which, if detected early, the prognosis is actually good. So early detection is key. So for our patients, please do talk to your primary care physicians about whether you are eligible and to get breast cancer screening, and if not, when will you be eligible and where you can get it done. And for that, coming to the next question, which is for Paula. Paula, where can people get mammograms in the UW system? What are the different sites where this is offered?
Yeah, thank you for having me. This is so important, and I'm so glad we're focusing on this for this month. So in our UW Medicine system, we have several places where mammography is available. So we have brick and mortar sites at South Lake Union, our UW Medical Center Roosevelt site, UW Medical Center Northwest site. We have our Eastside Specialty Clinic, and then down in Renton, there's a breast center at Valley Medical Center as well. In addition, we have our mammography van, which I know we're going to talk a little bit more about later, but that goes to several of our UW Medicine sites. It's at Harborview Medical Center and then at our Kent Des Moines Clinic. And we'll talk about some of the other community-based sites that the mammogram van goes to a little bit later.
So that's so very important for folks to know that we have all these different sites and they could choose according to where they live. We really have very good access through UW Medicine to provide mammogram services. And this brings me to my next question, which is for Nikim, and Nikim is from Population Health. So I would love to get your perspective. Nikim, how can people make appointments? Do they need referrals? And can people outside the UW system also make appointments with us?
Thank you, Annie. Yes, people, let me start from that last one. People outside of the UW system can get their mammograms with us. Most of our mammograms are done at the facilities already mentioned at Fred Hutch, Harborview, Northwest Breast Imaging Center, and Roosevelt Imaging Center. Sorry, did I say Harborview? No. So the patients can make appointments if they have my chart. In order to make appointments via my chart, if a patient will need to have a physician, a provider listed for them as their PCP, in order to continue to schedule their own appointment via my chart. But they can call the phone number and they can get scheduled at any of our facilities where they have the soonest availability. They do not need referrals, but it is good for them to get referrals because we have seen that some payers, some insurance companies require those referrals to be authorized in order to pay for the mammograms. So we say, yes, patients should try to get referrals from their providers, but it's not absolutely necessary. They can self-refer and still get scheduled for their mammogram. Thank you.
I think this is so very important for patients to know that they can self-refer. It is a good idea to get a referral from your PCP, or at least put them down, so that they can receive the results. However, we have several sites, and the phone numbers are, listed on the referrals, or they can call the main number and they can get get it that way as well. And as Nikim mentioned, you can go through my chart and make that appointment as well. Bridget, I'm very excited to find out about what Sierra Sisters offers. Please tell us about your organization and your work.
Thank you. Thank you for having me today. Sierra Sisters is an African-American breast cancer organization, and it was founded almost 28 years ago from my own breast cancer experience. Sierra is an African word that means knowing. If you have knowledge, you have the power to fight against the effects of breast cancer. And what we offer to the community is education, support, helping individuals navigate through a very complex healthcare system, and also advocacy, which is so important, especially to African-American women who sometimes finds the barriers very difficult and challenge when they're trying to find out what's going on with their body when they have a lump or other types of symptoms that may be ignored.
That's fantastic. And we can put information about Sierra Sisters in our chat. And if folks want to check that out, they could go to the website. Thank you so much, Bridget. Vicky, let's talk about the mammograms themselves. And sometimes patients are not aware whether mammograms are 2D or 3D. Can you please clarify that for us? Are all mammograms three-dimensional? And also, if you could talk about the screening versus diagnostic mammograms, and also talk about the procedure safety.
Thanks, Anita. The technology keeps getting better and better for mammography. The traditional 2D mammogram started with taking a photographic X-ray plate and doing one view this way and one view this way, and having those two-dimensional views on a piece of photographic film, X-ray film. Just like with CT scans or MRIs, there's now, with computerized technology, the ability to take multiple small images across an arc across the breast, and then actually for the radiologist's view to be able to make what looks like, instead of a flat surface, instead of just looking at a flat circle on a piece of paper, it actually looks more like a sphere, like you're looking at the original breast. The radiologists liken it to flipping pages through a book, where they're seeing all of the pages going by and getting all of those different views through the breast. And so it much increases the ability of the mammogram to pick up breast cancers, and it decreases the risk of getting false positives. So it's all in all a great improvement. There's been a shift at UW Medicine. We have shifted to 3D mammography as our standard. And you'll see out in the community that there's been a shift as well, some lagging behind a little bit, but it is the new gold standard for standard mammography. Your other question, Anita, was around
screening
versus diagnostic. And this is a really important one. And I think in Cam and Paula and Bridget can all agree that they have run into this issue as well. It is mandated by the Accountable Care Act that screening mammography should be covered by all insurers. And so there should be no copay, there should be no cost to a patient for getting a screening mammogram. However, a diagnostic mammogram is a mammogram done when a patient complains of a particular symptom. So if I find a lump or I have a pain in my breast and I report that, instead of taking a global screening view without knowing that there's any one area of particular interest, the radiologist, the mammography unit is going to be taking that whole global view, but also honing in on that area of additional concern. I would kind of liken it to if you went to someone for a skin exam and you just didn't tell them that there was a spot you were really interested in having them look at and just have them look at everything, versus saying, hey, I'm here because I have this spot I want you to check out. Many insurers consider that diagnostic mammogram, insurers consider it not part of the screening process. And so it is not covered under the screening benefit. And if your insurer has a deductible, which many insurances do, then you might end up seeing that charge because it would be applying to your deductible. So it's very important for people to be educated about that so that there's no surprises, and so that they can ask about the financing of that, and if there is a need for it, to be looking into financial assistance for that. UW Medicine does have a financial assistance program for patients who are eligible, and we really encourage people to ask about that.
That's so wonderful. Thank you so very much for clarifying, because often patients are confused whether they are going to get a screening or a diagnostic, or whether they should even report breast pain or a lump. And we'll come to that in a little bit as well. I also wanted to ask you, Vicky, patients often ask this, is this procedure safe? Of course, it's going to be uncomfortable, no denying the fact, but is this safe?
Very, very safe, but I think it's a very, very good question. And many people have asked this same question and researched it and looked into it. Mammograms do use radiation. It's very small amount, much like when you get a chest X-ray, except a much smaller amount than when you get a chest X-ray. So the amount of radiation exposure in a mammogram is, similar to the amount that you would get by taking some airplane rides during the year, or just being at just existing here on the planet, because we do get a certain amount of radiation. We know because of the increased survival rates from finding cancers early, that mammograms definitely improve life expectancy if you undergo breast cancer screening. So this very, very small exposure to the radiation involved in mammography, we think is insignificant compared to the huge benefit by finding cancers early. But it is a really good question, and one that has been looked at quite extensively.
Thank you. Paula, I have my next question is for you, and actually I have two parts to this question. The first thing is, can you please talk a little bit about services available to patients, because many of them are not English speaking. What kinds of support, services, and guidance are available to them? That's part A. And part B is, we are committed at UW to healthcare equity. Please tell us about the equitable access to breast cancer screenings.
Yes. So for our limited English proficient or LEP patients, We do have our education materials for breast cancer in multiple languages. We specifically have a breast cancer screening mammogram brochure that is available on our websites and is available at our clinics. On the mammogram van, they have the materials also available in multiple languages. We also, of course, are required to use interpreter services at appointments where we know that the patient does speak another language and would prefer to have their medical information provided to them in their primary language. And so those interpreters inside clinics, some of the clinics are available in person, but we also have telephonic and video interpreter services available. Additionally, and Nikem may want to touch on these a little bit more, we have patient navigators that are available in many clinics that will help our patients who are limited English proficient. Harborview in particular has a cultural caseworker mediator program that really are navigators who are specializing in particular communities and really will walk with a patient if needed, kind of from beginning to end through their care process. So those are just some of the services and resources that we have that are available. In terms of our commitment to healthcare equity in general and around breast cancer equity, we really want to look at it holistically and look at sort of the whole ecosystem surrounding our patients who are seeking out mammography and breast cancer treatment. And it starts with the providers, making sure that we have providers that are educated around the health disparities, what the inequities that our patients are already experiencing, that they understand what biases are out there and sort of the history of race and racism in medicine, and some of those things that perpetuate that keep our patients having high disparities and the inequities, so that they can kind of break down their own biases and understand some of the fears and misinformation that may be keeping patients from having the best outcomes and even seeking out care. We have to make sure that we're educating our patients as well about just the things that that Dr. Fong just talked about, that there's a lot of misinformation and disinformation out there around mammography and around cancer treatment. We also want to make sure that we can have patients know that there are organizations like Bridget, so that they can hear from other patients and become their own advocates and do a lot of their own patient education as well. We want to make sure our communities are educated, because it's not just the person with breasts, but that person with breasts also has family and friends around them that can also be advocates for them and continue to help them to make sure that they are getting the screenings, and then if they have the unfortunate case of having cancer, have the supports and can help them navigate through our health system as well. We have to make sure there's availability and access at our sites. You mentioned that, yes, we have, several sites, but even then we hear that those sites sometimes are not accessible, that we can use more sites in more different geographic locations and in more clinics. Having more brick and mortar sites. We recently got a second mammogram van, so that has expanded it, so that making sure that people have the availability to get to mammography. And then the last thing I had, and Dr. Fong touched on that, is the insurance barriers, those financial barriers. We've heard, although yes, it's supposed to be covered by screening, but yeah, that, switching over to diagnostic becomes a barrier, and we certainly want to do everything we can to break down those. So
thank you so much. And this is so very helpful, and I can actually vouch for the mammogram van and the amazing staff that they have. We had an outreach grassroots event, and we invited the van at our health fair, and most of the patients who got mammograms were not English speaking. English was not their first language, and they were, they had the most wonderful, kind, empathetic experience with the staff in the van, and all of them, they went and told other folks to come and get mammograms. So I think that's a testament to the amazing staff that we have in our vans. Nikem, I would like to address the next question to you. Is there a system to alert patients if they are due for their mammograms? And how are we keeping track of mammograms that have not been done? And also, is there a system to alert providers that their patients are due for mammograms?
Thank you. Yes, we are keeping track. The system we use is our EPIC EMR system, electronic medical record system. So when a patient is due for their mammogram, they will receive a MyChat message or a letter, depending on their preference for how they receive this kind of preventative care communication. So they'll receive that reminder communication, letting them know that they are due. If they've done a screening at other locations, maybe those locations will also be sending them reminders. So I know that some payers and insurance companies also send reminders. So we keep track of this. We have analytics dashboards where we're able to look at this, not only on an individual level, but we also want to make sure that all care is equitable. So we're looking at various subpopulations to see, is there any gap or any disparity? And we hopefully use the resources that are available to try to bridge those gaps. So we keep track also on an individual level using what we call health maintenance. So this is what our providers use. That's the system also for our providers to keep track and to order the mammograms. So the providers and their teams, when a patient comes into the clinic for a visit, the team from the front desk to the medical assistants to the back office, they're able to check health maintenance to see that a patient is due or overdue for their mammogram. So they will remind the patient, and the provider can make order that mammogram. So when a provider is in the visit, they can also easily order those mammograms through the various tools that we have put in place for them.
That's awesome. So we have a system in place which is provider facing and which is also patient facing. So patients do get those alerts. And when they do get that alert, it does not mean that their appointment has been scheduled. It means that they are due for it, and that either reach out to your primary care physician or their office to get a referral for that appointment. And then on the provider side, we do have our health navigators who will make appointments with us, meet us, from time to time, and alert us on our patients, if they are due for mammograms or other health screenings. Thank you so much, Nikem. Bridget, the next question is for you. Can you please talk about how you are spreading awareness and literacy around breast cancer screening, and how do you reach people at the grassroots?
Good questions. So we just hosted a World Mammography event this past Saturday. This is one of the things. We open it up to the community. There's no charge. Usually we have food, music, and educator. And Dr. Rachel Young was our educator for the day. She did a wonderful job. And so at the grassroots, this is how you are outreaching the community. And of course, people hear about Sierra Sisters. We do use media outlets as well. And the importance of mammogram is so important. And I can say this from my own experience, that saved my life 27 years ago, getting a mammogram as a young woman at 35 when it wasn't heard of, with no symptoms and no family history. So it's important. And we haven't really touched on the fact that African-American women are getting breast cancer at much younger than 40. So the screening guidelines are not really hitting that demographic. However, the message is clear to check your breast, and if you see something go in or you feel something go in.
This is so very important what you said about the cancer hitting African American women or population early. This is so very important. And Bridget, if someone in the community, if some folks in the community, they have cultural barriers or hesitation to get a mammogram done, and if they reach out to you, to Sierra Sisters, is there someone on staff who is able to talk to them, reassure them, and point them out, in the right direction? Is that something that you guys offer?
We do. We have a meeting once a month from January through October. Paula is a part of Sierra Sisters, and we're always so open to share our story and really address the fear, which is a barrier, which could cause people not to go in because they're so afraid that they're going to find something. But I think once they talk to individuals like Paula and other people within our group that may have already experienced breast cancer, or is there as an advocate, their mind is a lot more at ease and about going to get a mammogram. And not only that, but we also offer that we'll go in with you if you're afraid.
Wow, that is amazing. That is wonderful. So I think that, it really helps, especially for some folks when they encounter cultural barriers. It helps to have sort of a support system or a kindred spirit who can accompany them. So that's fantastic.
Yeah, it's almost like a rites of passage,
Yes.
As a woman, we take care of everyone else. This is a part of taking care of yourself. And we're owed that to ourselves.
I think that's wonderful. Vicky, I have my next question for you. What if someone has a suspicious lump on self-exam? What should they do next?
What I would say is the first thing is listen to what Bridget just said and really take it to heart, which is, first off, don't let fear stop you from investigating that lump. You have done a great job. You have been aware of your body. You have found something that's important to check out, and you are in charge of yourself. And so take charge and be reassured that the whole reason for checking into things early is that we can cure any most breast cancers that we find early, whereas we may not be able to if we only find them when they're very late in their development. So take charge. Don't be afraid. As it turns out, the majority of lumps that women find in their breasts turn out to be benign, which is great. Just as the majority of abnormal screening mammograms actually turn out to be benign in the end. So we're looking for cancers, but we're also going to see a lot of other things. And again, I like to use the example of, spots on our skin. Not all of them are cancer. Some of them are. We've got to take a closer look and make sure. So being aware is really important. So don't be afraid. Do go forth and get it checked out. Now, to get a suspicious lump checked out, if you have a primary care provider already, you certainly can reach out to your primary care provider. At UW, we also have a breast health clinic. And so you can reach directly out to the breast health clinic at the Fred Hutch, and they will expedite getting you scheduled in to have someone check with you to see if this is a finding that needs to be investigated further. Bridget, I know I've heard some of your stories over the years of women who have come in, having found something and being poo-pooed, being told that maybe that's nothing or you're too young. So if you are uncertain that you have gotten the correct advice, please stand up. Talk to groups like Bridget's to get some support as well, because we do want to make sure that we get you to the best care. So I hope that, Bridget, did you want to
Yes.
make a comment there?
I do. And here's the thing that happens. Sometimes doctors are only looking at the guidelines. And so they're not looking at this as an individual case. The guideline says this. If the guideline says that you've got to be over 40, you're really not at risk. And so they don't want to pursue that. Take the time and go get another opinion, because that is sometimes we're just dealing with humans and human errors and other issues and barriers. Maybe it's a doctor that doesn't look like you. So go and find another doctor that will take you very seriously, because this is your life. And you don't want to lose your life based off of someone saying you don't fit the statistics, because you don't want to become the statistics on the other side.
And indeed, one of the great places to get that second opinion is at the breast health clinic that Fred Hutch has. I mean, these are people who only do breast cancer screening. So so we want to be able, as a enterprise, to be able to offer that. So thank you.
So Vicky, I understand that, if someone has a lump and they go in, they should probably reach out to their physician and go in and get it examined. And then the next step may be that the physician orders imaging for them, in which case they go to one of the imaging places and they get it done. And it should be the same thing for breast pain. Even though most breast pain, especially in younger women, could be hormonal, it is still very important for women to go and get themselves checked out and be examined, and let the physician decide, of course, what's the next step. Now, let's say if someone got their mammogram and they have a suspicious looking lesion there, what is the next step for them?
So again, not all abnormal mammograms are going to lead to a biopsy. So the radiologists have criteria where they look at the abnormality and categorize what is the nature of it. And sometimes the recommendation is going to be to come back for additional images so that they can clarify what they saw. Sometimes the recommendation is going to be, this is a new thing, but it really looks benign to us. However, we want to check it again. So they may give a recommendation to repeat that mammogram screening in a shorter interval than you would normally have. But if it is a suspicious looking abnormality, often the recommendation is going to be for a biopsy and a consultation with a breast surgical specialist. And those are services that the imaging center and the PCP can both help get the patient linked up to people who can perform the biopsy, usually done at the same imaging center, and a breast surgical specialist. I do think it is good to get breast cancer care from breast cancer specialists who specialize in nothing but breast cancer care. So we don't want to have our mammograms done by a radiologist who is also spending most of his time reading bone x-rays and ankle x-rays, right? We want a dedicated mammography radiologist, which is what UW Medicine, the UW Medicine standard is. And similarly, for breast surgery, we want a dedicated breast surgeon, which is also our approach at UW Medicine.
So for patients, rest assured that once you get imaging, and if there is something there that needs a biopsy or needs another look, there are a lot of eyes looking at your mammograms, and you will have support to go to the next step and get a biopsy scheduled. Paula, I would like to direct the next question to you. Today's webinar is an example of community engagement that we offer. What are other ways that UW provides awareness and healthcare literacy around breast health? And can you also take this opportunity and talk about mobile mammograms?
Sure. Well, one of the other ways besides our community conversation series here that we connect with the communities is actually being out live and in person in the communities. We try to go to as many health fairs that are out in our communities, and particularly in our communities in Central and South Seattle and South King County, where we know that we have the populations that are experiencing the most inequities and have the biggest health disparities. We've partnered with Sierra Sisters on a number of occasions on their events, with Fred Hutch and bringing the Mammo van to some of their events. Other events that are not focused just on breast cancer, but just on health in general. We make sure that we have information about our clinics. It's always that we find people that don't have a primary care provider at all. And so making sure that people know that we have our wonderful ecosystem of primary care clinics out in our communities, and we try to get them connected to those. You mentioned that you had the Mammo van at your clinic, and so for this month of October, Breast Cancer Awareness Month, Nikam and her teams and our partners at Fred Hutch were very instrumental in coordinating and implementing a series of specialty clinics where the mammogram went to a number of our clinics around our system to have mammograms available. And of course, then that's a great opportunity to provide education and awareness as well. And speaking of the mobile mammograms, in addition to going to our UW Medicine primary care clinics, as I mentioned, Kent, Des Moines, and Harborview on a regular basis, we also partner with our community-based clinics. Some of our federally qualified health centers are FQHCs. So several in Seattle, Carolyn Downs, several of the neighbor care locations, also out in Bellevue and Issaquah and Federal Way. So the mammogram van, as I mentioned, there are now 2 of them that go out to various clinics on a regular basis. Some of them are there just once a month, some a couple of times a month. At our particular clinics, it's for at Harborview, it looks like it averages about 5 times a month. And in Kent, Des Moines, about 4 times a month, 3 to 4 times a month that it's there. And the mammogram van is available to do, just as I mentioned, other specialty events for other partners out in the community as well. So we try to spread the word and spread the resource around as much as possible.
Thank you. Nikam, with regards to population health, what percentage of our patients are due for mammograms?
That's a great question. So let me start by just talking about adding something to what Paula said. So I was recently at the soccer field at UW, where we had collaborated with the UW Medicine strategy and communications team. So it was called the Pink House Games. So generally on the theme was breast cancer screening awareness. So our team from primary care and population health, and then a Great Sorority was also there with education and awareness. So I spoke to several parents and families. I spoke to young women and others who were interested to know more about breast cancer and breast cancer screening. So those are ways we go into the community to engage with people around breast cancer screening. At UW Medicine, from the data that we have, we see, about 25% of our patients still need screening in the appropriate age group. When we look at some other age groups or subpopulations that we think there is a gap, some of these subpopulations include younger women who are around 40 to 49. So these are women or people where we believe that we could have higher screening. So, but we see only about 55% screening. So we still have about 45% of people in that age group that are not screened for their breast cancer screening. And then we also look at other groups like by race or by language. And when we look at these subpopulations, we see that they are less screened, less screening uptake. So sometimes up to 40 or 45%. We also have noticed some disparity in terms of screening amongst some of our transgender or non-binary patients, which might be even upwards of 60% that are yet to be screened. So when we look at the big picture overall, in terms of metrics, we seem to be doing well. But really, when we dig deeper, we identify some subpopulations, some subgroups, some of our patient groups where we definitely need to do some more work to bring them up to offer them the same opportunities to increase their uptake of screening. So when a patient gets a letter from their provider to get a mammogram, we have heard from our panel navigators that they do take it seriously. So that's why we don't relent. Often I have personally seen where when patients read those reminders about their mammogram, almost immediately, there was a day I looked at 5 patients and all of them in a row, they all had my charts. And I could see that they scheduled the same time they received those letters and read them. It was like 5 minutes later, they had scheduled their mammogram. So they do take it seriously. So I tell my team, I say to our navigator, please do not relent in communicating, calling patients, sending them letters and my chat messages, reminding them about their screening. They take it seriously. So it's one of our high priority work that we do.
That's wonderful. So if patients are getting a letter or a reminder on my chart, it's not an automatically generated robo message. There is someone who has dug deeper into their chart and noticed that they have not got their mammograms done. So I think that's fantastic that people are looking and keeping an eye and making sure that folks can be up to date on their health maintenance. Bridget, my next question is for you. What are some barriers that you feel patients encounter in terms of imaging? And I know you talked a little bit about this before, but can you also talk about some myths that you hear and how do you convince people?
Yes, so some of the barriers are one that they don't have transportation or daycare for their children. They're afraid of getting a bill that they can't afford to pay. They're also afraid of maybe going to have someone treat them that doesn't look like them. Those are real barriers. And then they hear that mammograms hurt and they're just so painful you don't want to get them. The radiation. So we talk about the myths, we talk about the reality of it may be uncomfortable, but it's only for a second and then it releases. We show them what a mammography machine looks like, And again, we also will offer to go with them to their mammography appointment. So those are how we deal with the barriers. And I'd say 99 out of 100, the women go and get their mammograms.
I think the most wonderful thing that you said is that you are willing to accompany them. I think that is a huge support for them. Thank you so much for your wonderful work. And this actually brings us to the end of the town hall. And I want to thank Vicky, Paula, Nikim, and Bridget. Thank you very much. And thank you, Priscilla, for making this possible. I think there was a lot of wonderful information coming out of this webinar, and I'm sure folks who are due to get their mammograms will be spurred to action. Thank you very, very much.
Thanks everybody for joining. There are a couple of links in the chat for the various resources that were spoken about today. Our Community Conversations website will have future recordings as well as information on future sessions. So please feel free to check that page back from time to time and to share with any of your family and friends. This is open to anyone in the community. I want to extend a thank you as well to our panelists and for this discussion today. Breast cancer has touched my life in multiple ways as well. And I think a lot of us fall into that boat, whether it's a family member or a friend. And this is just such an important topic, and this care is so important. So thank you so much for our panelists for joining today.
Thank you.
Thank you.
Thank you.
Take care.
Thank you.